In an Indian hospital, doctors prepare a 2-year-old girl for potentially life-saving surgery. She's going under the knife in the world's busiest cardiac hospital.
We do about 27 to 35 heart surgeries in a day. We can't let people die.
But it's not enough. 2 million people need life-saving heart operations in India every year, only a fraction of whom will get them. Globally, an aging population and chronic long-term illnesses are placing an ever greater burden on health systems, already struggling with mounting costs.
This world is running short of money. The way healthcare cost is escalating, it is unsustainable.
Patients worldwide could soon be paying the price. But can doctors find solutions that won't cost us our lives? In this rural region of India, most people are subsistence farmers.
ಮಳೆ ಬಂದರೆ ಮಾತ್ರ ಚೆನ್ನಾಗಿ ಬೆಳೆ ಬರುತ್ತೆ, ಇಲ್ಲಾಂದರೆ ಬರಲ್ಲ ಅಲ್ವಾ? ಹಂಗೆ ಒಂದು 30,000 ಇರ್ಬೋದು.
This 2-year-old girl is about to embark on a life-saving journey.
ಡಾಕ್ಟ್ರನ್ನ ಕೇಳಿದಾಗ ಒಂದ್ಸರಿ ಹಾರ್ಟ್ ಎಕೋ ಮಾಡಿದ್ರು. ಆವಾಗ ಸ್ವಲ್ಪ ದೊಡ್ಡದಿದೆ, ಹೋಲ್ ಇರ್ಬೋದು, ಸರಿ ಜಯದೇವಾಗ ಹೋಗಿ ಚೆಕಪ್ ಮಾಡಿಸ್ಕೊಂಡು ಬನ್ನಿ ಅಂದರು. ಹಾಸ್ಪಿಟಲ್ ಆಪ್ರೇಷನ್ ಮಾಡಿಸ್ಬೇಕು ಅಂತ ಹೇಳ್ತಿದ್ದಾರಲ್ಲ, ಆಪ್ರೇಷನ್ ಮಾಡಲಿ, ಒಳ್ಳೇದಾಗುತ್ತೆ ನನ್ನ ಮಗಳಿಗೆ.
Without surgery, little Chitrasri faces a lifetime of chronic illness, breathing problems and potential heart failure. But she's one of the lucky ones. She's been given the opportunity to go to the city for the treatment she desperately needs. Globally, there's a chronic illness epidemic that's increasing year on year. Illnesses like heart disease, diabetes, lung disease, and some cancers now account for 70% of worldwide deaths. With growing life expectancy comes rising populations and increased pressure on health systems to cope with this silent epidemic. This is where Chitrasri is heading for treatment, Narayana Cardiac Hospital in Bangalore. It's been set up by health pioneer Dr. Devi Shetty.
Life expectancy is going to reach 100 years soon. When the life expectancy increases, there will be a lot more diabetics, lot more patients with the heart problem, brain stroke, joint problems, various cancer, all kinds of problems.
According to Dr. Shetty, of the 2 million people who need heart operations in India annually, only 5% will get them. So he and his colleagues have taken a radical step to make it affordable. It's an approach they call frugal innovation.
We have no money, but we can't let people die, so we have to come up with innovations. Busy heart hospitals in Western countries may do 2 or 3 heart surgeries on children a day, but we do at least 10 to 15 of them.
This morning, one of those operations will be Chitrasri's to repair the hole in her heart. Here, surgeries like hers cost as little as 3% of those carried out in Western hospitals.
That's the reason why we created hospital. So today we are in a position to perform one of the largest number of heart surgeries in the world. By doing large number of operations, you utilize your infrastructure to the fullest extent. We work 6 days a week, 12 to 16 hours a day. That is the only way you can reduce the cost.
The long hours help to maximize efficiency, servicing a virtual conveyor belt of patients. As Chitrasri is taken to the operating theatre, the surgical team there are still with their previous patient. As she's anesthetized, the medics are standing by to begin her operation. The same seamless workflow is being duplicated by cardiac surgery teams in the hospital's 22 other operating theatres. Meanwhile, Dr. Shetty is consulting on dozens of other cases without even leaving his office.
ঠিক আছে আপনি 1 মিনিট ধরুন আমি অ্যাঞ্জিওগ্রাফি ফিল্ম দেখবেন পরে ডিসিশন নেবেন ঠিক আছে
This is another piece of frugal innovation intended to minimize unnecessary and costly hospital visits.
You will be surprised within the next 10 years there may not be an outpatient program in most of the hospitals. All the chronic diseases will be managed where the patient is at home and doctor is treating the patient from his home.
When managed like this, hospitals are only used for critical treatments, like Chitrasris. It's an approach that's starting to have resonance well beyond this hospital in India. East Harlem, New York City. In this neighborhood, more than 1 in 5 people suffer from chronic diseases like diabetes. With mounting pressure on the local health systems, an innovative new project is trying to cut hospital admissions by helping the most vulnerable patients in their own homes.
Just ask a lot of questions, figure out what's going on, get from them what they think's going on. Be super curious around what's happening.
These health coaches have no formal medical training, but they meet weekly with their clients to help them understand and manage their conditions.
I have a new client too that I'm working with, his family, and she was telling me how her son is more irritable and things like that. And it turns out that they feed him a bowl of Cheerios at 6 in the morning, and then he doesn't eat again until 2 p.m. Yeah, exactly. exactly. But it's just like they're so fearful of, this diabetes.
Hilda Mejias is off to see a client who's been battling with type 2 diabetes. If left uncontrolled, it's a disease that can lead to serious physical complications. But simple lifestyle changes can dramatically reduce the risk of hospital admissions.
A large core of the work that we do is to prevent our clients going through crises, and crises meaning, them having to walk into ER visits or spend a lot of time in the hospital or waiting for doctors by walking in, and it also saves a lot of money, saves thousands of dollars. The doctors don't have enough time. They get 15 minutes with a client every 2 to 3 months. So us meeting them weekly and working with them for half hour to an hour really helps to prevent a lot of crises from occurring.
Hilda and her fellow health coaches are recruited from the neighborhoods in which they work, so they understand the challenges faced by the people here.
I watched my grandma, go through a big struggle living with diabetes, and then she went to the hospital and she never came out. She just gave up at that point. Hi, Shirley. I want to prevent, other people in the neighborhood that I grew up in, the community, to not go through that.
It's this local connection that enables Hilda to motivate and educate her clients.
So it's 400 calories.
You did mention the sodium content in here.
The salt.
Yeah, which is very high. You want to try to stick to 5% or lower, and this is at 37.
Now that they said diabetes is stable, kind of watching that.
Your pressure?
Yeah. And they want to increase medication for that, and I'm like, oh no, let me try.
Okay.
Put it under control before you just give me some medicine.
Yeah.
In just 2 years, it's claimed this community initiative has averted emergency hospital visits for a quarter of their clients. They're now working with New York's Department of Health to help redesign how it delivers care to patients with all kinds of long-term chronic diseases. Back in Bangalore, little Chitrasri is in surgery to repair the hole in her heart. She's attached to a heart-lung bypass machine as the surgeon carefully closes the gap. The operation will take over 4 hours. In India, hospitals can benefit from light touch regulation, cheap land, and far lower labour costs. In the West, healthcare providers can't hope to replicate this model, but they do need to implement their own frugal innovations. One of London's oldest hospitals is working with a health innovation studio to save time, money, and lives. It's not run by medical professionals, but designers.
At Helix, we are looking at the management of chronic diseases. We're focused on frugal innovation, coming up with cost-effective solutions that don't have huge barriers to entry and that are scalable.
Today, they're testing a mobile phone app that could help over 1 million children in the UK manage another chronic condition, asthma.
Sit straight, breathe in as much as you can, and exhale as fast as you can. Well done. You caught the bug.
This child-friendly app is designed to encourage kids to monitor their condition and alert them to triggers in the hope it will avert hospital admissions.
So this is your peak flow reading, which is really good because you're in the green zone.
Britain's National Health Service spends £1 billion a year treating asthma, yet it's estimated that 75% of hospital admissions are avoidable. Cheap, simple and effective innovations like this app could potentially have a huge impact on health budgets, not just in the UK, but around the world. While pressure on healthcare systems varies from country to country, they all share one common challenge: to maintain standards while reducing costs.
People living in developed countries think that for every problem there is a solution. But if a solution is not affordable, it is not a solution.
Chitrasri is recovering after a 4-hour operation. She'll be able to return home in just a couple of days.
ಆಪರೇಷನ್ ಆಗಿದೆ, ಸಕ್ಸಸ್ ಆಗಿದೆ, ಮನೆಗೆ ಹೋದ್ಮೇಲೆ ಅವ್ರ ಫ್ಯೂಚರ್ ಬಗ್ಗೆ ಕ್ರಮ ಕೈಗೊಳ್ತೀವಿ.
India will prove to the world that wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. And once India does it, rest of the world will follow.
Medical pioneers alone can never solve the countless problems facing global healthcare. But they can provide inspiration, especially if saving money can help to save more lives.